Welcome to the section on syphilis. Syphilis is caused by a spirochete type of bacteria called Treponema pallidum. Usually we can see this with a dark field microscope after this bacterium has been fluorescently stained. When we talk about spirochete, it actually is in a spiral shape. Usually we treat it with penicillin. It's transmitted by direct contact. It's usually a venereal disease, and it can also be transmitted via the placenta to the fetus. Some of the signs and symptoms include, upon entrance to the body, the bacteria is carried by the blood to every organ in the body. The incubation period is usually about 3 weeks, but can range from 10 to 90 days. Primary syphilis is the development of a characteristic primary lesion called a chancre, and it's usually only a single chancre that's present. It's commonly located around the genitalia. Well, after a few weeks, usually the chancre goes away. Then we go into secondary syphilis. Usually within 2 to 8 weeks after appearance of a chancre, we find headache, sore throat, low-grade fever, occasional nasal drainage. Blood tests also show moderate increase in WBCs with an increase in lymphocytes. This usually progresses to lesions of the skin and mucous membranes and lymphadenopathy, which is swelling of the lymph nodes. Well, after a little while, this chancre goes away as well. We then enter what's called latent or tertiary syphilis. This non-infectious state is usually when a diagnosis can only be made by serological methods such as a blood draw. After 2 to 4 years of infection, secondary syphilis signs will reoccur. During relapses, patients are infectious. Usually 1/3 will develop tertiary syphilis. This is seen at the 3 to 10 year mark. We see lesions produced, the skeletal system can be affected, we see cardiovascular and central nervous systems being affected, and we can even have congenital syphilis, which is caused by the spirochete transferring across the placenta. Some of the things we can do to check to see if somebody has syphilis are looking for 2 different classes, specific and non-specific types of antigens. Sometimes we look for the specific antigen on the spirochete itself, but other times we're looking for a antibody called a Regan antibody. There are the presence of 2 types. We can do the non-treponemal, which looks for the Regan antibody, doing a VDRL and an RPR. We'll talk about those in a second. Or a treponemal, which is looking for the exact spirochete called the FTA-ABS. The VDRL stands for Venereal Disease Research Laboratory. This is a non-treponemal method. It's a flocculation test, which is the soluble antigen particles will form larger particles, which become visible. This is a test we do on spinal fluid. RPR is called a rapid plasma reagin test. This is a non-treponemal method looking for that reagin or reagin, whatever you want to call it. Most widely used treponemal method there is. We use a flocculation type of test for this as well, but it's more commonly done on serum rather than spinal fluid. The final one is the fluorescence treponemal antibody test. This one looks for the actual Treponema pallidum organism itself. Usually this is used as a confirmation test, not a screening test. So once the RPR or the VDRL are positive, we would follow up with the FTA-ABS test to make sure that it is actually syphilis that is the issue. Usually we overlay treponemes fixed to a slide with serum from a suspected patient. We put a fluorescent tag on there, and the FTA-ABS should always be followed to confirm a positive RPR or VDRL. So we wouldn't just do this right off the bat. This is a confirmation. The ABS suffix refers to particularly to a process step using to remove nonspecific antispirochetal antibodies present. So we are testing specifically for the spirochetes with this method. There are some famous people who they believe died of syphilis. These are kind of fun to read. Christopher Columbus. He was born in 1451 in Genoa, Italy, and he sailed from Spain across the Atlantic Ocean in 1942 and discovered the route to America. It was believed that the spread of syphilis across the globe was probably sparked by Christopher Columbus, and he became infected with syphilis, who later died of the disease. People say George Washington may have died of syphilis. It is believed that he had syphilis and died because of it. However, there is no evidence to back up this claim. Napoleon Bonaparte. He was born in 1769. He was the first ruler in the Bonaparte dynasty. He conquered and ruled much of the Western and Central Europe. He was also called the Enlightened Monarch. He too suffered from syphilis and probably died due to consumption of arsenic, which back then was a treatment for syphilis. So it's kind of it can treat syphilis, but it can also kill you. Franz Schubert was born in 1797. He was a very gifted composer slash musician. He is best known for his German art songs for voice and piano. His symphonic work represented the best legacy of the classical tradition, while his songs exemplify the height of romantic lyricism. But he battled with syphilis since 1822, and in the midst of his career, his health deteriorated. The cause of his death was consumption of mercury, which was also a common treatment of syphilis in the 19th century. So people taking arsenic and people taking syphilis trying to treat this. That concludes our section on syphilis.